Hello, Assalamu alaikum rahmatullahi wabarakatuhu. Good morning, good afternoon, and good evening, everybody. Welcome to another episode of Shaji's Vlogs. Hope you all are doing good. Today I am going to discuss some most probable questions for the agency nurse. Okay, here in the UK, you all know we can do some agency work as well, agency nurse work as well. If some of the standard agencies, they are conducting the interview as well, so they are providing the good rate also. So this interview, most probably they are asking the same questions and the same pattern. So I thought it's very useful for others. If you are practicing or go through this video, that will help you to pass the interview. Okay, so here almost 10 or 12 questions they are normally asking. Okay, so we will be ready for answering those questions. All of the questions we know, we already going through in that situation. So this video is for you, whoever looking for agency interview or attending any interview as outside the NHS hospital, if NHS hospital as well. Okay, so the first question is, when you are entering, most of the questions they are asking based on the scenario based question. Okay, so first question is, when we are entering into a ward in the first time, so before the handover or after the handover, before we starting to work, what are the things we need to know essentially? Okay, so this question they are asking based on what we think about when we are entering into a new ward. So we know that when we are entering into a ward that is not familiar to us, first we need to know the fire evacuation plan. Okay, so where is the fire exit? Okay, and also another thing is emergency alarm, how we can activate the emergency alarm, and essentially it's for the crash trolley. Okay, so these are the things you need to know, okay, that you can answer accordingly. And the second question is the employment history. Okay, which specialty you are in. Okay, that's relating to if you are an adult nurse or you are a mental health nurse. Okay, so you can answer these questions also accordingly. If you are an adult nurse, you need to do one thing. You can just keep your CV with you. So if you want to, it depends on the interviewer. Some interviewer, they are expecting the answers in a detailed way. Some interviewers, they need they need the short thing only. So accordingly we can answer. If they are asking in detail, you can just keep your CV with you so that you can answer these questions according to the years you are working. Okay, so that is the second question. The third question is, how qualities of good record keeping. It should be legible, brief, and there should be name, signature, and date and time. And if we need to make alteration, draw single line through a word, and avoid correction fluids, and the records should be kept confidentially. Okay, that should be the answer. And the fourth question is, it is related to NMC code. Okay, what are the NMC code? Everyone knows the 4 P's, right? Go back to our OSCE. Okay, so what are the 4 P's? Prioritize people, practice effectively, preserve safety, promote professionalism and trust. Okay, so these are the 4 P's. We can answer very easily. And another question is, what are the rights of medication? Okay, that also we know the rights of medication. We know the 5 rights of medication. Now the NMC, they added to 5 more rights to the medication. Okay, so we can just memorize that one. Like right patient, right drug, right dose, right time, right route, right to refuse, right to education, educate the patient, and right to assessment, right to evaluation, right to correct documentation. These are the 10 rights of medication. Some interviewer, they will ask like 3 or 4, some will ask 6 or 7, some will ask the 10. So you can throw with all these, okay. And another question is regarding to the drug administration error. So that will be based on a scenario like if you are working in a ward, in a medical ward or surgical ward, the patient is allergic to some drug, allergic to example penicillin, and we by mistake we administered the drug to the patient. What will be the immediate action we are taking? Okay, that is the question that you know very well what we need to do when the medication error happens, so that you can answer accordingly. Okay, I'm not explaining each and everything, you know everything, right? So you can answer these questions accordingly. Okay, and another question is what is mean by equality and diversity? Okay, that is definitely question in the interview. So these questions answer also everyone knows, but again I am telling you, the equality refers to provide equal opportunities to everyone, and protect them in discrimination against the people. Okay, so then diversity. What is the diversity? Diversity means recognizing, valuing, and respecting the differences in people. Okay, that is the diversity. Okay, this question also they will ask normally. So the next question is the type of abuse. Yes, type of abuse. What are the type of abuses? Some people they are asking like 3 or 4, some people 5 to 6, some people 6 to 7, like that they will ask. Okay, so we need to familiar with all these abuses, like what are the abuses? Physical abuse, mental abuse, sexual abuse, behavioral abuse, financial abuse, institutional abuse, then what is emotional abuse. So you can just go familiarize with all these terms, okay, so that you can answer very easily. Okay, next question, another important question actually, that is the news score interpretation. Okay, so they will give one scenario based question. Suppose you are working in a surgical ward, you got a post-operative patient, and you got the news score of 6 or 7, what you will do? Sometimes they are asking the course action. Okay, sometimes they are asking like what will be the immediate action you are taking, or some interviewer they are asking like what this news score indicates. So we need to prepare what we will need to answer. Okay, you know very well the news score is 7 or 6, we are getting the news score 7, what we will do the immediate action. So you can just memorize what you are what is the course action, what are the course actions we will do. And in news score 7, what it indicates, definitely it's sepsis, possibility of sepsis. Okay, so you can answer the questions accordingly. Okay, right. And another questions they are asking like pressure damage. You know this country UK, they are giving the priorities regarding this pressure damage, like it's most important question actually. Every interview they will ask the questions regarding that, because in UK they are potentially they are preventing this pressure damage, they are giving more importance to that. So the how we can prevent the pressure damage, so we can answer accordingly. We know everything actually, right? Okay, so just memorize everything one more time. You will refresh your mind, like what we can do, how what are the actions we are taking to prevent the pressure damage. We can use the pressure relieving mattress, and we can use the skin the barrier cream, like some derma cream. And regarding the nutritional requirement of the patient, we can make sure that, and like that you can answer accordingly. Okay, so yeah, these are the questions. Understood the video and the question and the answers as well. Okay, I'm not writing the answers because most of you are familiar with that. So if you have any doubt, you can just let me know in the comment box, or you can send a mail to me as well, shajisvlogs@gmail.com. Okay, so thank you so much for watching my video, and wishing you all the very best for the interview, who ever preparing for the interview. Okay, and if you like my video, like it, and support me to subscribe my channel as well. Okay, thank you so much. Have a nice day. Bye bye.